I'm here at Maui Derm, and I'm here to talk about combination treatments. So it's 2025, and if you're not doing combination treatments, then you are living in 1995, so it's time to catch up. So what is a combination treatment? It is combining injectables with peels with energy-based devices. And energy-based devices range from muscle tightening to tissue tightening, to eliminating fine lines and wrinkles through resurfacing, to eliminating brown spots as well. So what is an ideal combination? Well, it depends on the problem. So for example, a woman in her late 60s, early 70s, who's had a fair amount of cumulative sun exposure comes in. She has laxity, she has some of the dimpling that I call pseudo-cellulite, which is really tissue laxity, as well as brown spots and kind of that overall crepiness thing that can happen. So what's the best approach? Well, first of all, we like to start treating from the lower level, the deepest layer of the skin on up. So the deepest layer of the skin, we're gonna start with some tissue tightening. So tissue tightening using micro-focused ultrasound, such as with a soft wave or with L-therapy, that's the first step you do. Then the second step, you can combine a IPL or a laser that's designed just to treat brown spots, such as the neodymium YAG, along with a peel. And all of this can be done in one visit. Now, one of the most important things is to instruct the patient that they need to use at-home skincare, of course, but also that it's going to be a series. Rome wasn't built in a day. So you want to be sure that the patient knows up front that it's going to be about 5 treatments, because you're going to make a whole plan for the year. So that, shockingly, and I showed this in the session here, that shockingly is very effective. Secondly, we also like to look at the legs, because in Southern California, we are not wearing clothes most of the time. Well, we're wearing some clothes, but less than on the East Coast. So every body part is as important as every other body part, and you so don't want to have the face look one decade and your legs look a different one. So legs are tricky, we all know that. There's not as much blood supply there. So what do we do here? So in this case, especially below the knee, it's not necessarily so much about tissue laxity, it's about quality of the skin. And so people often come in looking like a leopard. So they've got brown spots, they've got those very flat or stucco keratoses, and they may even have a lot of actinic keratoses as well. So it has also been shown that when you use any kind of laser, whether it's a fractionated, whether it's an IPL, that you're actually going to improve the ability of the skin to correct sun damage. So not only are you improving the cosmesis of the skin, but you're also improving the health of the skin. So it's a good idea. So what do we typically do? We typically will combine a fractionated laser along with one of the newer no-peel peels. The one that we like to use is called the PRX, and it's a combination of benzoyl peroxide with TCA, which shockingly gives the same result after several treatments as a TCA peel, but without the peeling. So we do that, we may do that in a single session, and then we come back, and then sometimes we'll treat individual ones with a stronger TCA or using the neodymium YAG laser. And on top of it, then we will use the carboxy or the CO2 lift mask, because applying that mask increases the ability of the skin. What it does, it's like a topical hyperbaric oxygen chamber. So because it delivers CO2 and lowers the pH of the skin, you actually unload the oxygen from the hemoglobin and you get a higher oxygen level in the skin, and you get vasodilation and delivery of more growth factors. So we found that to be incredibly useful. All right, now let's move up to the face. So looking at the neck, everybody hates their neck. Doesn't matter almost what age they are. So we all know that the first thing you want to do, and we call this the jack, when the jawline blends into the neck. You can have a young jack, you can have an old jack, different causes, and I'm not going to get into all the details. But the bottom line is, even in a youthful person, the platysma can be too strong, and it can pull the whole face down, ruining the look of the jawline. So you want to start there with injection of a neuromodulator. Now, Botox has recently been approved for this indication, and in fact, I was an investigator in the clinical trials for Botox. So it's very exciting, because one thing when you do a clinical trial is you actually see the number of units that are needed for that indication. So that's very helpful. So look for that information to be coming your way soon. So we start with relaxing the muscle. Then, depending on the type of or the type of neck a person has, we'll use an energy-based device, followed by something like a fractionated laser or an IPL, depending on the age of the person and the quality of the skin. And then if some people, and even young people, have necklace lines and they hate them, and it's like, to me, I'm not so young, to me it's like, your neck looks phenomenal. But they're like, no, 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 doctor, I've got these like grooves here. So then we go in and fill. And so using a filler that actually is a little less concentrated and softer really helps, so that you could actually do a very nice job there. Another treatment that we've had very good success with is using hyperdilute CAHA or Radiesse, as well as hyperdilute polylactic acid. So injecting in a whole fan and using a reconstitution volume that has been published, so look for those articles, you can really, over time, rejuvenate the skin from a different way, and what we now call regeneration. So there's that. Then, in terms of the jawline, a lot of people have retrognathia. So they just don't have much of a chin, or they just need a little bit of definition of their jawline. And for that case, there are several products that are FDA approved for the chin. Volux is one of them, Voluma, and so these are very useful to use along the jawline, and that will help treat the neck. Now, one tip here is that you can also use, I tend to use a cannula along this area, but you can also deliver the product using a needle and coming from not the side of the mandible, but come right under it, and you'll see that picks up the jawline nicely. So don't be afraid, use everything you have in your toolbox.